I think it is. Okay.
Okay, this
Uh,
small group communication, the three Nurseketeers, Nicole Burkett, Lana Carlson, and Taylor Coakley.
awesome. All right. So, oh my gosh. All right, so small group communication. Small group communication includes verbal and nonverbal interactions. It really happens when members create and perceive, interpret, and respond to one another, and a small group usually consists of 3 to 7 members.
So we decided to talk about the concept of the triangle of communication. At any given time, the nurse, doctor, family, friend, patient, etc., we can switch roles between the sender and the receiver, which is when the message goes from the sender to the receiver and is received accurately and consistently. This can also be interpreted as, in the healthcare setting, that there's a nurse, a doctor, and a patient, and how all three must communicate together in a constant stream of communication to be sure that the messages are accurately received for patient safety.
Effective communication. Patients want to know their diagnosis, their care, and their treatment. They need to feel confident about their care. And two big things that were brought up in different articles were the clarity and the consistency of the plan of care. Consider the patient's perspective when making the plan of care. The doctors and nurses should present the information to the patients clearly and build that nurse-patient relationship. The nurse should consider each patient's needs and requirements when planning their care. Each patient is going to be unique, so they're all going to have different needs. There may be, as a nurse, you're going to need to be resourceful and open to using different means of communication. You may have to use a whiteboard if the patient's on a ventilator to communicate, because obviously they're not going to be able to talk, so you're going to have to be able to let them write to and interpret their communication back and forth that way. Other things, interpreter services, again, clear communication to make sure that they're understanding their diagnosis and treatment plan.
So the next stage that we decided to talk about was we believe that a big problem in the healthcare environment is there's such a clash of personality styles. Not only are there different economic standpoints, there's also the personality standpoints, different religions, different cultures, etc. So we decided to talk through the personality styles in this presentation so that we could get an understanding on the different kinds of people that we're going to come interact with. So I'll be discussing the 4 general personality assessments. So there is a personality assessment that we took during this class, so I decided to use that as the base of our ideas. So the communication is a personal process. The communicator, uses his or her natural style of communication and ideals when sending their messages. By learning these styles, we need to learn all of these styles so that we may interact correctly and be able to have an efficient style of communication, really knowing how these people react positively and negatively to different kinds of situations will be very helpful in being able to not persuade, but be able to consistently be able to communicate with them. So the first communication style that we are talking about is the lion. So these individuals, they may seem abrasive and direct, but they're very effective leaders because they have a lot of passion and they want to get things done and keep moving and keep improving. So they're very, take charge kind of people, task-oriented, want to go fast-paced and go, go, go. However, like I said, they're sometimes too direct or too impatient. They may be impulsive and take big risks, and that may not work well with other personalities. So to be able to talk to them, you need to be direct and blunt and just a one-way communication. Say, this is how I'm doing it, and really, don't beat around the bush. one of their weaknesses is that they're not as good as a listener. And as we discussed, between the triangle of communication, the sender needs to send their message bluntly, but the receiver needs to open up their ears and really listen to what is being said. So to be able to have the lion personality increase their ability to communicate, they would need to be softer, become a better listener, acquire more empathy for people. So next we have is the otter, and so this type of person is a great person to have in a group. They keep the energy up. They are very excuse me. They bring a lot of initiative to the group, and they completely they lack initiative, and they are not always completely follow through with their ideas. So they're very optimistic, energetic, people-oriented, etc. They're also fast-paced people, but they're sometimes a daydreamer. They may be impatient, overbearing. A lot of times they want to just do it and get it done. They don't pay attention to the details that come into everything. So they are very good at inspiring other people and being very enthusiastic. However, they're high energy sometimes, and they may attack the other group members, not specifically on purpose, but they are more of a manipulator to get things to get done how they see fit. So to help with them, they need a lot of improvement, or a lot of approval, opportunities to verbalize, and they need a lot of social recognition to feel like they are accomplishing everything. To be the best communicators, they need to be a little more attentive to other people's needs, and they need to be a little more realistic. So next we have the golden retriever state. So this is a people person. They want to see everyone as happy as possible. They want to do things to make everyone, as happy, and do a lot of take on other people's roles if they need it. They're very sensitive. However, they do often put other people above their needs, which can be it can be very frustrating in a group, because they're not willing to take stands and I will do this. They would rather sit back, see what other people do, and really just pick up the pieces after that. They're very warm and relational, a big team player, people-oriented, but they're also more slow-paced, and they're more sensitive. They like to attract the hurting kind of people, and really be they want to really just sacrifice themselves for other people to keep the harmony in the group. They're very indirect on exactly what they want. They'd rather just kind of go around it instead of blatantly saying I want this. They just kind of beat around the bush and eventually get there. For this, it is very important that they give emotional security, and make sure they have minimal stress and drama. They really need to feel secure and be able to. They thrive in a non-dramatical environment. So to be able for them to be more effective communicators, they need to learn to say no, establish healthy boundaries, and learn to confront people when their feelings are hurt. So finally, we have the beaver, and these relational, their strengths are they're very accurate and precise. They're very task-oriented. However, they're slow-paced, and they're very analytical. They can be too critical at times. They like to also be very controlling. They may be a little more negative on new opportunities. They'd rather just stick with what they know and keep going from there. Sometimes they can also be a perfectionist, so they get stuck on one sort of task and try to make it as perfect as possible, even when that might not be realistic. They really need to feel like they're doing quality work, and they need to know their exact expectations, and they will fit to those expectations exactly as needed. And they also need a lot of time to do their quality work, because they are more perfectionist type of people. For them to be able to be better communicators, they really need to realize that perfectionism is not always possible or realistic or necessary, and that they need to, although some explanation is needed, you don't need an entire schematic of one simple idea when it can be said in much simpler terms. I think we see a lot of these personalities in the hospital. Everyone's different. Everyone has a different personality. So being able to realize and be able to connect with which person is which and understand this is a very blunt, direct person. I need to know exactly what I want to say right now. Or this is an emotional person. I need to appeal to their emotional side is very important in the hospital. And with people understanding these concepts, I believe, and we believe as a group, that there will be an increased amount of satisfaction and more effective communication in the healthcare setting.
Thanks, Lana. Since we've reviewed 4 of these personalities, hopefully you've identified maybe yourself as what personality you fall under, and then when you are taking care of the patients in the healthcare setting, you are able to identify their type of personality and maybe fit your care into their personality traits. So we move into increased satisfaction with care. Respect is an important part of the patient engagement. Trust in their relationship with the healthcare provider is important. If they don't trust you, they're not going to participate in their care, and the plan will not go along correctly. Listen to the patient, hear their needs, ask for permission to treat them. Is it okay with you, Ms. Smith, if we do your bath at this time? Those types of things. Make sure that they're engaged and that it is felt from their standpoint that they have participation in their care, that they can plan. Listen. That's a big part of small group communication, and when you're caring for that patient, are you really hearing what their needs are? When you are listening, you are perceiving, interpreting, and responding in the message being delivered. As a good listener, you play a strong role in the small group communication. Sorry. Communication skills. If a healthcare provider increased communication skills and timing, patients will no longer need to rely on the internet and the media as the main source of their health information. As we all know, there are many things out there on the internet that you can search, and one of your symptoms will follow under many diagnoses. So we'd rather not have them self-diagnose themselves, but trust in their care provider to understand the plan of care and understand their diagnosis. Complications with communication. Complications are very frustrating. It takes an increased amount of time to then re-explain if the patient does become frustrated. The family dynamics, make a big part of this, and depending on how they are perceiving the information or what their stance is in the relationship with the patient, really can make or break the situation. Lack of training. Time constraints are a problem. There is, as a nurse, you may have 2, depending on what area you're working in, maybe you have 2 patients that you're caring for, or you may have, on the floor up to 7 patients that you're caring for. So you have to be quick with your care, but yet concise about the treatment that you're giving the patient. Unclear goals are frustrating for the patient. They need to know their plan of care and what the ultimate goal is. Inconsistent, insufficient, and poor quality care. Families feel uninformed. So again, open communication, making sure they understand. If that's the first time you've seen them throughout the day, update them. Make sure that they understood what has gone on throughout the last 24 hours since they were here to see their loved one. With this, again, everybody, there's going to be many culturally diverse patients, and you need to know how to communicate with them. Again, you may be using an interpreter to communicate with them because maybe they speak a different language. So this can cause frustration from all sides of the triangle of communication. From all sides, and then the triangle of communication can come in when one side does not pay attention to cultural or vulnerable background of the other. Never assume that a patient understands when there is a barrier.
All right. So like Nikki was talking about, diverse populations can cause kind of a different roadblock when it comes to communicating with our patients, whether there's a unique characteristic that makes it, so maybe they're a victim of domestic violence, or maybe they speak a different language from a different culture. Things are all going to be a little bit different with that. So it's really important to really think of the communication process as an exchange process. Don't think of you talking to the patient, you telling them what to do, but really, rather having it be a give or take kind of relationship. So don't think of it as a one-sided thing, but rather just an exchange of communication and negotiation with the patient. Because if you involve them more in the care, like we've talked about before, they're going to be more likely to be involved in that and want to put forth the effort to take care of themselves and work towards that goal too. So just making sure you're keeping a balanced side with that. But then also incorporating their culture and their values into the care where it's possible. Obviously, if it's something that's going to hinder their healing process, you want to be careful of that, but making sure that they feel involved in the recovery process. And then also just remembering culturally competent care. As a future healthcare worker, as these two other ladies are already obviously in the healthcare field, you have to be willing to learn about different cultures and different ways of communication. And it's really important that you're willing to expand your knowledge about that. So you can learn all the skills you can as a healthcare worker, but until you can be competent in those, but until you're able to understand how key effective communication will truly take on the role of being an exceptional healthcare professional, because you're able to not only perform those tasks but also communicate with them effectively, make sure they know what's going on, making sure they feel confident in their care, because ultimately you're caring for the whole patient versus just their illness or their ailment. So.
Excellent. So yeah,
right.
So to kind of wrap things up, so basically we talked about how there's a triangle of communication, whether that be it does focus on, you know, between the sender and the receiver, and then that being a message, being able to go, you know, the sender, you know, says it, how he sends the message then is then heard, and then the receiver must be able to stop and think through it to be able to respond. But we also took it on our own spin of the triangle, saying how there's a patient, a nurse, and a doctor, and how oftentimes the nurse is the center point, or, you know, the I don't know how to describe it. There's a center point between the care of the patient and the doctor. They are oftentimes the translator, and so it's very important for all these, you know, aspects to come together, such as the personality and the caringness and the satisfaction and the cultural differences, so everything to come together, and so we can increase our communication and be able to provide safer and better care.
Very good.
Thank you.